Content warning. This episode makes brief mention of suicide and self-harm. If you are in crisis and need immediate help, call or text the Suicide and Crisis Lifeline at 988.
Welcome to the Bare Naked Shrinks.
Hello, and welcome to the Bare Naked Shrinks with me, Dr. Courtney, and my fabulous co-host, Dr. Dany.
Hi.
We are going to be stripping down disordered eating and negative body image for you in each and every episode. Over the course of this first season, we'll bring various experts in the field to better understand disordered eating and body image. Today, I am going to discuss eating disorders among LGBTQ plus folks. But to start things off, let's get into our
cake and crap.
So I realized that I'm going to have a hard time answering this question probably in terms of my cake because I did fun things every day this week after work and all of them have been cake. It's been really fun. And so I'm going to kind of cheat. I went and saw a movie with some friends on Tuesday night, and then Wednesday I went to a Seattle Storm game, the women's WNBA game, with some friends. And then last night I hung out with another friend and she made me dinner, which was great. So I guess just like socializing generally is fun for me. Like I said, so that's definitely my cake. I think my crap, I have a couple patients that I've worked with for a while now that I absolutely adore and are challenging. And I think like once I work with someone for a while and get to know them, I just feel more emotionally invested. And so I think then when there's some type of struggle, it definitely impacts me more. And I have sought a lot of consultation this week around these cases, which has been super helpful. And I'm so thankful for my team. And just like, I don't know, feeling stuck or like kind of uncertain about how to help someone move forward with making positive behavior change is just hard. So I would say that would be my crap this week. What about you, Dany?
I did not nearly have as fun of a week as you, as always. Like we talked about last time.
I don't have kids, so
yeah. And I mean, and I think my cake and crap sort of are related to my kids. Superficial cake and crap. I got my custom made, I don't know if you can see it, brat necklace, which will be appropriate for when we talk about temperament. I cut my bangs this morning. That may be a little bit of cake and crap. I'm finally going to get my pink out of my hair in like a week though. So I am looking forward to that. Is the pink that will not go away. So cake, lively, fully potty trained, no accidents.
Oh my gosh.
She had her first trial run this week at preschool to see if she would hack it for a full day. And they were like, she's doing great. She's already made friends, no accidents. So that's been awesome. And then crap, I mean, she's been having temper tantrums, but I would say this is sort of appropriate for the topic today. So Wilder's favorite color is pink. He used to say it was red because he would get made fun of for saying it was pink. And he has kind of long hair, and we did the same pink on the tips of his hair, like a dip dye look. And he was really excited about it and proud of it. And we're going to do more this weekend. I'm going to do it like officially, like not just the wash and shampoo. And at school, he got called gay, and it really hurt his feelings. And he said, it was really cute though. He was like, it's fine to be gay. It's not an insult, but I'm not. And I was like, yeah, exactly. Like, it doesn't matter if you are or you're not. But the fact that somebody was using it as a mean thing, they were saying it to be mean. So we had to have a big talk about that. And the school actually handled it really well. They called us, they called the other kids' parents, and they took it very seriously. And he wasn't super emotionally upset, but it just bummed us out that
totally
that is still being said in 2024.
Yeah. Dr. Dany last week talked about the biology around eating disorders and brought up the topic of temperament. And so she posted a temperament measure on our website for y'all to take and kind of explore what your temperament might be like. And so Dr. Dany and I both took the temperament measure, and we're going to discuss our outcomes. My highest score was on the category of harm avoidance. And within that, I scored highly on, warm communication and attachment. So I like to think that I'm pretty good about taking risks, but like, I guess I'm still not. I'm still pretty cautious with most things, and yeah, harm avoidant. My second highest is self-directedness, with high scores on helpfulness, empathy, and compassion, which like that makes a lot of sense in regards to like the career I'm in.
Right.
And
Good thing.
I guess like the fact that I really like to socialize, like totally makes sense. I really like being around people.
Yes.
And then the next two are tied. So I'm tied with reward dependence and persistence. So with high scores on being a perfectionist. Unsurprising. I like to think of myself as like a perfectionist in recovery. And yeah, I guess sometimes maybe.
But these sort of measures really get at the core, they get at your biological basis. And you can, as you've probably done a lot of work to not be like that anymore.
I would say that I have. Yeah. And then my other high score and persistence is responsibility, which also makes a lot of sense.
So I have a follow-up question. I noticed some of the subscales I was like off the charts and really low, but those didn't necessarily correspond with my overall. So if you look through all of your subscales, what was your highest subscale and what was your lowest subscale?
So my highest subscale is, warm communication.
Oh, okay.
Warm communication.
What was it? What number?
It was a 95. And then I have 94 for helpfulness.
Dang, you were like off the charts in those.
And then perfectionist is a 92.
Dang. Okay, what about your low?
Empathy is 91. So
nice.
None of that is surprising.
No.
Lowest. Okay, so my lowest is shyness with strangers.
OMG, so is mine.
Really?
My very lowest, like dramatically different from all the rest. I got a 20.
So does that mean that we're not
shy with strangers?
That tracks for both of us.
Yes. What number was yours?
37.
Yeah, mine was 20, which again, I am just way more unfiltered and whatever than you, apparently. Okay,
That's
and then my highest subscale, it was in the idealistic category, but that was not one of my highest overall areas. Just look at those and guess which one it was.
Obviously, extravagance. Definitely your highest.
That was my
100%.
highest.
Unsurprised.
That also tracks with our not demure trend.
100%. Yeah.
Okay, so for the overall scales, my two highest were reward dependence and persistence. But they weren't like off the chart high. Reward dependence was 65, persistence was 63. Yep. And within reward dependence, work hardened is my highest. And under persistence, it was resourcefulness. Scrappy.
Also tracks.
But yeah, that was fun. I do feel like I want to say, though, with this measure, so I found this on a website called IPIP. And basically, they do have some legitimate measure. We're talking right before we recorded about how ridiculous I look when I drink water and I look like a frog. And then Courtney just took a drink of water and
spilled on my face.
Did not look like a frog. Just spilled.
It looks like a child.
So these measures, all of them on IPIP, some of them are like validated real measures, but a lot of measures are copyrighted and you have to buy them. And testing is very expensive. So they have sort of dupes or hacks. And so this one was a dupe for the Cloninger temperament and character inventory. And, basically it's not going to give you exactly what you would get on that. So just want to throw that caveat out there.
I guess it's probably time for us to get down to the educational portion of the day.
Lunch. Yummy.
So like I mentioned, I'm going to be talking to y'all today about LGBTQ plus folks and eating disorders. This is an area I feel really passionate about, especially as somebody that identifies as queer myself. So research consistently suggests that LGBTQ plus populations experience a much higher prevalence of psychopathology just generally. And so the idea behind this is that this is attributed to the increased stress that these folks experience, like stigma and prejudice, that can also then potentially result in trauma symptoms down the line. Especially when we think about eating disorders, these folks face a heightened risk of experiencing eating disorders and body image concerns. Research suggests that approximately 87% of LGBTQ plus folks report dissatisfaction with their bodies, and that approximately 54% of LGBTQ plus adolescents have been diagnosed with a full syndrome eating disorder during their lifetime, with an additional 21 suspecting that they had an eating disorder at some point in their lives. Eating disorders are really common in the queer community. Additionally, almost 70% of LGBTQ plus adolescents report engaging in at least one eating disorder behavior over the past year. So this is a thing that's happening in the queer community that I think deserves a lot more attention and research, given that it is so common. And what we know about eating disorders is that they are associated with high risks of mortality and morbidity. And the data suggests that LGBTQ plus folks that present to eating disorder treatment actually have more acute eating disorder symptoms. And then those that are hospitalized for medical complications in regards to their eating disorders are actually much more likely to have an additional mental health disorder and a history of self-harm or suicidality, which then suggests that they probably have less favorable prognosis for the future. LGBTQ plus folks who have received an eating disorder diagnosis versus those who do not have an eating disorder or have a subclinical eating disorder have a 4 times greater likelihood of past year suicide attempts. So that's also pretty scary. What we also see is that gender diverse communities have a 2 to 4 times greater odds of experiencing an eating disorder compared to cisgender adults. And this is likely related, at least to some extent, due to the body image distress that is emphasized by underlying gender dysphoria or dissatisfaction with an individual's gender role. So there's some research that suggests, and I say some because this is still an area that we don't have a ton of research in regards to, but the research that we do have suggests a link between gender identity and eating disorders. And so what we see is that oftentimes, especially for individuals that are transmasculine, they will use like restriction to suppress secondary sex characteristics so they don't experience those. So oftentimes like restriction can be a mechanism to cope with puberty and aims to attempt to decrease some of those more feminine parts. Also for individuals that want to identify as like more masculine, there's muscle building behaviors that can be problematic that are used to increase muscle mass. This can be associated with things like muscle dysphoria. Individuals that experience conflict between their biological sex and their gender expression are at heightened risk of engaging in some type of problematic behaviors in attempts to match their presentation or match their appearance more closely with how they would like to express their gender. So we see that happening a lot. And a lot of times this manifests in terms of like some type of added behaviors around food or exercise that can again then be problematic. We also see individuals that have undergone any type of surgeries to have their bodies be more consistent with their gender expression or gender identity, that actually those recoveries or transition phases can also be associated with some disordered eating. I've actually seen that quite a bit in my clinical practice. And then one of the things that we see a lot, and this is not just with individuals that are within the queer community, but generally is that disordered eating behaviors are often used to help cope with emotions. They're used as an emotion regulation strategy. This is something that I think we'll probably talk about in future episodes when we dive more into dialectical behavioral therapy, which is my specialty. But the way that I view eating disorders is that they emerge as a way to cope with uncomfortable emotions, and they can be effective initially and then become problematic over time. So individuals in the queer community definitely, as experiencing heightened prejudice, discrimination, harassment, and things like that, can then turn to disordered eating behaviors to cope with the negative emotions that those might evoke.
You mentioned that trans masculine individuals tend to restrict in order, maybe not have as round of hips or thighs, things that are stereotypically more common in females. So I have a patient right now that we were talking about this the other day, and I sort of have a different approach to treatment because it's very, very different. Like if you are restricting your food because it's confirming your gender identity, the treatment approach has to be extremely different and extremely sensitive. How do you approach it?
Yeah, I mean, what we need to think about is how to take an individualized approach within whatever type of evidence-based treatment we're providing, right? Something that I wanted to highlight too is that we actually don't have evidence-based interventions for individuals within this community that experience eating disorders. And so we really need more like identity affirming interventions for these folks, because we want to make sure that we're supporting them within their eating disorder recovery, right? We want them to be compliant with their nutrition and fully nourished, while at the same time getting them to a place where they can feel more confident in their body and how they are expressing their gender identity.
I think even just saying to patients that, acknowledging that, validating that is really helpful, and I think helps them understand. Also, whenever people start taking tea, sometimes they have a thickening around the middle, which, it can be problematic, but it also is validating with, the growth of hair or other more masculine qualities. So it's a real uphill battle for these folks.
Yeah. And actually, when people are put on tea, we typically increase their ideal body weight that we want them to get to for that reason. They kind of normalize that.
Yeah, there's so much more education that needs to be in our field because there's just not enough research on it. I'm glad we're bringing it to light.
Yeah, it's few and far between right now. So what I also want to talk about is understanding the prevalence of disordered eating within the LGBTQ plus community and where this comes from. So the minority stress model is typically used to explain the mental health disparities within this community. It's the leading theory explaining the greater eating disorder risk facing this population and suggests that eating disorder risks partially results from experiencing chronic stressors due to being part of a marginalized group. So this model suggests that individuals from the LGBTQ plus population experience stigma from societal structures, including discriminatory laws, policies, community attitudes, and these things promote unequal treatment. And so this structural stigma then leads to external minority stress, such as victimization, discrimination, harassment, and lack of social safety. And then internal stressors, such as internalized homophobia or transphobia and concealment of sexual or gender identity. And so experiencing these stressors then, as you might expect, contributes to experiencing negative emotionality, which then can contribute to the development of ineffective coping mechanisms to navigate this distress. And then, in conjunction with the societal pressures to adhere to certain beauty ideals, eating disorder symptoms emerge as a way to cope with minority stress by investing in things related to appearance domains that are perceived to be controllable. And so what we see is, there are certain appearance standards, even within the LGBTQ plus community, that are different from folks in the heterosexual community or that identify as heterosexual. And so research really supports this tenet of minority stress theory, and it demonstrates that LGBTQ plus adults that experience discrimination from their identity are 5 times more likely to develop an eating disorder compared to LGBTQ plus adults who have not experienced any discrimination. And so research actually highlights pretty strong associations between internalized stigma, sexual orientation concealment, rejection sensitivity, and eating disorder symptom severity.
This model is so validating, Courtney, and we have a visual on the website that I think people will really appreciate.
And it's adapted from a colleague, Dr. Tiffany Brown, who does a lot of amazing research on men and non-binary folks and queer individuals generally. She adapted the minority stress model specifically for eating disorders. I highly recommend you check out her work and that visual.
And Tiffany is going to be on a future episode talking about the Body Project.
She is. Yes, she's fantastic. I did an overview there of the prevalence of eating disorders among LGBTQ plus individuals and what we think of that contributes to that. And I really, again, want to highlight that there's still a lot we don't know about eating disorders and body image within this community. I'm kind of speaking about LGBTQ plus folks right now almost as a homogenous group. And we know that that's not the case, right? There's a lot of differences within the community as well. And what we actually see is that a lot of folks with eating disorders in the community actually go undiagnosed or don't get the care they need because there is such a lack of education in this area and research on this population, which I've mentioned. Part of the reason for this, I think, is likely due with some of the limitations that we have about assessment for eating disorders. So a lot of our assessments for eating disorders are validated within heterosexual white populations. And therefore, when applied to individuals that don't identify in those categories, it's harder to accurately get an idea of the prevalence of eating disorders among those folks or identify that they even meet criteria for an eating disorder when our assessment is focused on a certain population. So because of this dearth of research, there's also this limited understanding of the mechanisms that we need to support effective treatment for this population. And there's already so many barriers to receiving treatment just generally. And for LGBTQ plus folks, there's even more barriers, such as real or even perceived stigma. And then that makes it more difficult when treatment does not appropriately match some of the maintaining mechanisms of disordered eating behaviors, like the things highlighted in the minority stress model. So most of our treatments for eating disorders are developed and evaluated by women and targeted for women. Overall, men and then non-binary folks are less likely to seek treatment due to lack of recognition from others. It's female focused. The cultural views around eating disorders, there's a lot of stereotypes that eating disorders only impact white high SES women. And so there's some judgment towards men that are seeking help for something like an eating disorder. So we need a lot more research and a lot more education in this area just generally. And again, like I was talking about with Dr. Dany, there's not really treatments that actually match these individuals within the queer community and the unique things that they experience that contribute to their eating disorders. So we really need identity affirming interventions that focus specifically on gaining skills to cope with things like reactions to stigma and learning strategies to reduce the maladaptive minority stress reactions or coping skills. These things are desperately needed. So I want to wrap up with a couple things. One is just mentioning the fluidity of sexuality. I'm a firm believer that sexuality is fluid and that we kind of all fall somewhere on the spectrum of sexuality. And so this is consistent with research done by the Kinsey Institute. The Kinsey scale was developed to demonstrate this flexibility or continuum of sexuality. And instead of assigning people into categories just like heterosexual, bisexual, and homosexual, the team used a 7-point scale ranging from 0 to 6. So people fall anywhere on this continuum. And there's a visual that will be linked as well if you are unfamiliar with what the Kinsey scale looks like. This can be really helpful because it acknowledges the spectrum of sexuality and that it's static, can change over time. It highlights bisexuality as visible and valid and can help people understand their sexual experience and this idea that there's actually room for exploration. Now, the Kinsey scale is by no means perfect. There are definitely some flaws. So I just want to highlight that it excludes non-binary, trans folks. And so those individuals might find the scale limiting, and it focuses on sexual behavior rather than sexual identity. For example, a lesbian who came out later in life, like me, might have a large history of having sex with men, but that doesn't mean that they're not a lesbian. It also doesn't consider the attraction piece. So for some people, there's a difference between romantic and sexual attraction, and it might oversimplify sexual orientation. Just things to think about. And then finally, it also might pressure people to fit themselves into certain categories. We use labels, boxes, categories for the sake of understanding somebody's identity. And I'm actually hoping that someday we can move towards identifying that those categories are kind of erroneous and that people can be attracted to and in relationship with whomever they want based on how they feel in the moment. So I think that boxes can be limiting, and I have a whole tirade about that, but I'm going to not do that right now. And then finally, something that I want to also encourage y'all to take a look at if you haven't heard of the Gender Bread Person. It's by Sam Kellerman, or the website is, it's pronounced metrosexual. And basically it's an infographic that illustrates 4 main concepts of gender identity, gender expression, biological sex, and physical and sexual attraction. And each concept is represented on a continuum, and then the difference between each is highlighted. I'm not going to go over that right now, but definitely something that you can take a look at. That wraps up all that I wanted to say on that topic. And we're going to transition now to Dr. Dany interviewing me.
Interview the expert.
That was a great presentation, Dr. Courtney, and I actually learned a lot. This is not my specialty, although it really should be all of our specialty based on the prevalence that you described. So I know you fairly well, but I would love for our audience to get to know you better because you are just an incredible person, and I would love for people to know you better. So first of all, we'll start with just the background, where you grew up and what your family was like and what your growing up experience was.
Yeah, well, technically I was born in Seattle, lived in Seattle till I was 6, where I am now. And then I moved to the other side of the state in Spokane, Washington. So I consider Spokane home. That's where I grew up, went to elementary school and high school and things like that. Most of my family still lives over there. It's the oldest of 3 kids, probably contributes to a little bit of where my perfectionism comes from. I grew up in a pretty privileged family, access to a lot of resources. I went to a private Catholic school.
The Catholic school, that I didn't know it was Catholic. I knew you went to a private school, but that adds up with the whole shame conversation we had, as well as leads me to my next question. You mentioned coming out late in life. I am curious, and I don't know this myself, so I'm genuinely curious. When did you first have any inkling that you were romantically or sexually attracted to females?
Yeah, great question. I think growing up Catholic and more conservative, it never felt like an option to me.
Do you remember any of your first crushes? Like, I remember watching The Sandlot and thinking that the main character was like so cute, and he was my first crush. And then I also had a crush on like Matt Dillon when I watched The Outsiders. So do you have any memories like that? Because those are really our first crushes, right? Like celebrities when you're young.
I have more memories of being really into Mary-Kate and Ashley Olsen and Hilary Duff. And I didn't identify it as a crush at the time, but I think looking back, that kind of makes sense. So yeah, so I truly just like never thought it was an option. And I think grew up pretty homophobic. And then when I went to grad school is really when, for the first time, I was actually exposed to more diversity, truly. I went to grad school in Richmond, Virginia, which is a much more diverse city than Spokane, Washington. My second year of grad school, I was with a friend and she was talking about her sexual orientation and asked me, have you ever thought about being with a woman? And I was like, oh my gosh, no, I truly haven't. It just had never crossed my mind. And I was like, that's interesting. And that night I was with a woman for the first time, unsurprisingly.
Wait, say it again?
That night I was with a woman for the first time.
Wow.
So, yeah, that was my second year of grad school. So probably 10 years ago at this point.
What did you think when you had that experience?
I think initially I was like, I'm exploring. I feel like we saw that a lot in media. Girls like explore their sexuality, but it's just a phase or something like that. So I dated that girl for a while. She also was in grad school with me. And I remember being pretty excited about it. And I didn't get some great comments from people. And so I think that contributed to me not exploring that aspect of myself very much.
Like other people in your life that you were close to?
Yeah. Whose opinions I took pretty seriously. So I dated a few women, but not many. And then I met my ex-husband.
When did you meet him and what made you say, okay, I'm going to go for it and marry this dude?
We met my third year of grad school. So we met less than a year and a half after the first time I was with a woman. He's pretty effeminate himself. He listened to me. We were really good friends. I think that there was definitely some societal pressure to settle down, get married, those types of things.
How old were you when you got married?
I was 30.
Kind of young even for people in academia, just because we're in school for so dang long. So how long were you married?
Well, we were together married for like 3.5 years.
Because the divorce took a while. I remember that was one of the first times I met you. You were telling me about that whole situation. It was in DC at the International Conference for Eating Disorders. And I was just enamored with this story. And it was like from a movie.
Yep, it feels that way.
And then, okay, so you separated and then moved to Seattle for work, right?
Yep.
And then when in this period of time did you say, I actually am a lesbian? Like, see ya, dudes.
Well, I had like joked when I was married that if I ever got divorced, I would probably be with a woman, which is interesting reflecting back on, right? And then when we separated, I actually was with a guy for a little bit and then met a girl and was like, oh, wow, this is different. And then was with a guy again. And at that point, I was like, this is definitely not what I want. I have been missing out on an aspect of myself. And so that was June of last year of 2023. And so that was when I started identifying as a lesbian.
How was the coming out process for you with your family, with your friends?
Yeah, I was definitely nervous. And I think every member of my family was like, oh yeah, that makes sense. I first called them and told them that I was dating a woman. I remember feeling so nervous. And I was like, really? You're not surprised? And they were like, Courtney, you used to say that you wanted to date a woman. This is not surprising. I remember my mom being like, yeah, I felt like there was like a 50-50 chance. Neither of my parents seemed surprised at all, which was pretty funny.
Well, and validating.
Yeah, and validating.
Was the first woman you dated seriously when you realized that your identity was lesbian? Was that in San Diego or Seattle?
San Diego.
Okay.
Yeah. So family was supportive. I actually have 2 female cousins that are also gay. So that definitely made it easier for me in regards to family. And most of my friends are psychologists. So
that is helpful.
They were all extremely supportive. Nobody really like blinked an eye.
That is helpful.
Yeah.
So it sounds like, a lot of the coming out experience and experiences you've had so far are pretty positive. But I know for people watching, they can see this, but for people listening, you are very like traditionally attractive, girl next door, very femme. And how has that experience been for you? Because I know that can be hard. You and one of your friends both bonded over this as well.
Yeah. My friend Abby and I think it's interesting because on the one hand, for the most part, I don't feel like coming out was hard for me. It was pretty easy. I really didn't get any like shame or stigma or anything like that. The hardest part, which I think I have judgments about even saying that this was hard, but were the comments like, well, I would have never guessed that you were a lesbian. You don't look like a lesbian. That has generated a lot of, well, does that mean my attraction to women is valid because I'm so feminine? And so for a while I was like, do I need to change my appearance? Should I cut my hair?
Yeah, it's like a whole new adolescent experience almost.
Yeah. So I think that part has definitely been challenging and being okay with being super feminine and girly. And that's not something I want to change about myself. So it's been, how do I navigate both of those things? And one thing too is any place that I go, just because of the way that I look, people just assume I'm straight. So I frequently get hit on by guys, and that's not ideal.
Yeah. And even if you're at a gay bar, people may assume you're just an ally.
Yeah.
That's tough. So another thing that fits into this episode is I learned not too long ago, I never knew this, that you struggled with an eating disorder when you were younger. I want our listeners to hear about that because I think it'll be very inspiring since you are so successful now and, doing really well in your eating and body image. So when was your disorder? What were your symptoms? Have you looked back and figured out, oh, this was tied to maybe my sexual identity?
I don't remember a time when I didn't struggle with body image. So I think that was there a lot of my childhood and a lot of anxiety. I remember being a very anxious kid.
Interjection. Do you think the body image stuff also came from being very tall? For those who don't know, you're extremely tall.
So I'm 5'10", and I was 5'10" in like 7th grade. And so up until 8th grade, I was the tallest person in my class, and I was taller than all the girls and all the boys. And I hated being tall. I thought that I was like a monster, truly. I was like, this is awful.
I have a ton of tall patients and they feel the same way.
Yeah, the tallness definitely made me feel pretty uncomfortable in my body. So I started dabbling with restriction, things like that, when I think like 6th or 7th grade, around then. And I was a competitive swimmer. So I also would do extra exercises and engage in some of that compulsive behavior. So that continued and got worse over time. When I was a junior in college, I had a family friend pass away from an eating disorder. And my mom called me and told me about that. And I was like, wow, I didn't know that you could die from that. And she's like, yeah, we should probably get you some help. And so that's when I started treatment for the first time. And I did a couple rounds of treatment between IOP, PHP, residential, and that pushed me back. Took a couple years off college for that reason, which was definitely pretty hard at the time. And research is research. So I think part of motivation to get better for me was like, okay, I can use my experience to help others. So that then pushed me into the field where I'm at today. And I have thought about my sexual identity and whether that has contributed to my eating disorder. And I don't know. I feel like since identifying as a lesbian, I definitely have kind of come into my own and have feel more authentic. And at the same time, I wouldn't say that my attitude towards like my body or food has changed because I kind of already did that work. So I don't know. I'm sure that there's some component of that, right? Like not feeling like I I could be myself. I don't know if I see like a clear link there just because, it was so long ago.
So outside of all of these deep topics, you enjoy going deep into the ocean. And I want to hear about how you got interested in scuba. It sounds terrifying to me.
What?
And yes, seriously, I have a little bit of harm avoidance. So I want to hear how you got into it and how much of a part of your life scuba is.
My friends growing up used to joke that I was more graceful in the water than I am on land. I've always loved the water. I was a competitive swimmer. I love being in the water, by the water, near the water. My favorite animal is a dolphin. When I was younger,
I was just going to say you were like a dolphin, and on land you're a little giraffe.
Accurate. Yeah, like a little awkward giraffe. That's totally true. Literally for like 5 years in a row, and my birthday was when I was a child, I wished to be a mermaid. Still kind of want to be a mermaid. That's still like my life goal. Not sure if that'll ever like truly happen, but scuba diving is the thing that I got closest to. So I actually got certified right before my honeymoon. My ex and I went on our honeymoon to Fiji and got certified for that. And I immediately fell in love because exploring underwater is so cool. You get to be with the dolphins, the colorful fish, beautiful corals, and it helps me fulfill my dream of feeling like I'm a mermaid. So after that trip to Fiji, I was like, I'm obsessed with scuba diving. And well, it would have been my 5th-year wedding anniversary this weekend. So it's been about 5 years now. And since then, all of my international travel and a lot of my travel generally has all been around scuba diving. The other thing that I love about scuba diving is that it's a very mindful activity. You do have to be focusing on your breath. And it's a great way to focus on being present and what's going on around you so you can attend to all of the things. And then also, as someone who has done a decent amount of solo travel at this point, it's a great way to meet people. You are on a dive boat for maybe weeks at a time or like a full day or something, and you meet people. And I've met so many cool people from around the world diving. It's just like such a fun way to travel. And I love being on the water. When I was living in San Diego, we were so close to Mexico that it was so easy to do long weekend trips to Mexico to dive. Fortunately, it's a little bit harder to do in Seattle, but I just booked a trip to Thailand for the winter to go diving. So I'm pretty excited about that.
That's awesome. So when you're talking about going out on the boat, have you seen the movie Open Water?
I don't think so. Maybe I shouldn't see it because it sounds scary.
It's like a real life story. A husband and wife, I'm pretty sure they're husband and wife. It may have been a honeymoon, and they went diving out in the water, and like the person, the scuba company, diving company, whatever, didn't do the proper protocol of counting, and they got left in the ocean.
Yeah, I don't want to watch it.
Every time you go on a dive, I need you to say, what is your protocol for ensuring everyone is back on the boat?
You use dive buddies.
But they were the dive buddy of each other. My OCD is coming out, but I need you to do that checking behavior, please.
Okay, noted. Noted.
Okay, well, that's all the questions. And thank you. And thank you so much for being so vulnerable. I think that it's just a wonderful quality you have, and one of the reasons that I initially gravitated towards you.
Yeah, I'm pretty much an open book, which has its pros and cons, but I think mostly pros. So your homework, you better work.
Work it, y'all.
I would like everyone to take some time to review the Kinsey scale and just think about where you might fall. And I want to note that like a lot of people think that there's a certain like test or quiz to identify where you fall on the Kinsey scale. And there's actually not one out there that's real and valid and reliable. There's a lot of fun ones. So if that's something that you're interested in, I totally encourage you to do that. Just note that these measures aren't like backed by science. And then also take a look at the genderbread person, get familiar about the differences between gender identity, gender expression, biological sex, and attraction. Think about where you might fall on the continuum. And then finally, check in with your LGBTQ plus friends. Be curious about their experience with identity-related stigma and discrimination, and inquire about whether this might impact their eating habits or body image, and show them some support. So make sure to go to barenakedshrinks.com to download your weekly homework. Stay tuned for our next episode, Mary Jane's Last Dance, with Dr. Britt Boher, who will be discussing substance abuse comorbidities and eating disorders. If you like what you've heard, seen so far, please follow us on Instagram, TikTok, and YouTube. And please rate, review, and subscribe to the podcast. Talk soon.
Bye.
See y'all next time.